ready-made emergency reference guide for people who might have to be answering phones in ways that they didn't before. Even if you don't have a written policy and procedure, it's important for everybody to have something in their mind about policy and procedure so that you can make consistent choices about what you're going to do with phone calls. And it's actually really similar to everything we learned at school about who, what, when, where, why, and how. This is kind of an outline, written or not, of a way to think about how you're managing incoming contacts with patients that will also include being able to identify where your task ends and somebody else has to step in. So, what is the task? Why do you care about this task? In this case, the task is helping patients who contact SFM. So, why? Well, several reasons. That's what you're here for, but you also want to do it in a high quality way, which means consistency and thoughtfulness. And you also want to make sure that you're doing it in a safe way, so that if something happens because of a technical glitch, like the frequency of the dosage being incorrectly converted, do you have a systematic way of identifying that and making sure that it doesn't become a patient safety event? And best of all, or most important of all, your internal policy and procedure needs to be, if I get a call that's different than I've ever received before and I'm not sure if Washington lets me do this or not, who is my first line of authority after that? How do I find out what to do so that the patient is managed efficiently, but so that Sound Family Medicine and all of the other healthcare providers are protected? Any questions on that? Okay. So, if you have a strong and dynamic policy and procedure, it's also something that you guys can check yourself back on. This is a performance measuring device then. And it's not a performance measuring device in terms of A, B, C, or anything like that. Nobody's going to give you a report card, but it's something that you can measure yourself against. So if you know that you're getting calls about X topic and you're feeling uncomfortable about that, you go through your policy and procedure, you seek out the information you have, and in a consistent way, you get to build your knowledge and experience while still reinforcing the consistency of how you're engaging in your tasks. Gives you an opportunity to improve, and it also gives you an opportunity to work with one another, because a lot of times when an individual starts hitting a circumstance or they start getting calls, we take calls 8 to 5, Monday through Friday. Our risk management consultant is on call to respond to anything that comes in. And we have to talk with one another about that periodically, because sometimes we'll start getting a bunch of the same question and we will have no clue why. And if we were just doing it on our own, we might just get 2 questions and think, oh, that was an anomaly. But if we're able to categorize and consistently document what we're getting via the phone, we can start identifying trends. And we know that we need to change some of our training out in the community, or that we need to distribute publications or an article or a tip card, or that something new is coming up and we need to bring in some attorneys so that we can appropriately address that. Having a policy and procedure in your mind about how to handle incoming phone calls and having a way to communicate with one another may mean that you're able to more quickly adapt and address the needs that you're getting by the phone. So it allows you to redefine your objectives and your process. Documentation is a big thing. Now, one of the things I saw in the policy and procedure that you have is there is actually some guidance on the documentation on a content level. These are the types of telephone consults or calls that you get that need to go in the chart. And what you need to do is make sure you're all aware of the standard format that Sound Family wants you to do. So here's going to be the first question that I give you. What is the standard documentation format that Sound Family has by policy for the phone calls that you get? Okay, excellent. Oh, you got it. I thought I heard somebody say I had written it down. So, the issue with SBAR and the difference between triage and telephone call management is that SBAR has that word assessment and recommendation. And I just got done telling you that, you know, if you're not a licensed healthcare provider, you're not allowed to make clinical assessments or clinical recommendations or decisions. That doesn't mean, however, that you aren't assessing the facts that you're getting and what to do with them. And it also doesn't mean that you aren't in a position to recommend who has to make that decision, you know, who it gets routed to based on whatever standard operating practice you guys are using. Does that make sense? So I don't want anybody walking away from here saying, well, she's come in and said that because of some claims involving some bad telephone assessment and a bad outcome, we can't document the way that we've always been documented. That isn't what this means. What it does mean is that by using that standard and having a policy for conveying the information to a clinical decision maker who then makes the decision and issues the order, everybody's going to be able to consistently find the information, and the rationale for any decision making is going to be present. Had this kind of documentation taken place with that claim I just told you about, then the MA would have been able to document what was read, what was done, etc. And the clinical decision maker would have gone on, read that information, seen, hopefully, what was done, and then made a different recommendation about getting to the hospital right away, starting medication right away. But this level of documentation wasn't done. Everybody here is responsible for documenting what they do with their patients. And SBAR is an appropriate and very efficient way of doing that.
Is there a plug-in? Do I try to plug it in?
So I have a question about,
Okay.
so when you say a lot of times I'll put the phone call from the patient